Namaskar. Heart problems are on rise tremendously. According to World Health Organization, cardiovascular diseases cause 17.9 million deaths in 2019, accounting for 32% death all over worldwide. Therefore, it is critical to recognize cardiovascular problems as soon as possible so that the treatment begins early, and the treatment could be in terms of counseling and medications. Hence, today's talk would be on coronary heart diseases. We will discuss in brief what this condition is, what causes it, and so on. We have to understand where we are going wrong and prevent its occurrence, and also learn ways to better manage it. Most importantly, I'll share some very effective yogic management techniques that can help you to manage your condition effectively. Let's understand what coronary heart disease is. Coronary heart disease is a condition that develops when the major blood vessel that supplies to the heart gets damaged. Cholesterol deposit or plaque in the coronary arteries and the inflammation are some of the causes for coronary heart disease, also known as coronary artery disease. The coronary artery supplies blood, nutrition, and oxygen to heart. A buildup of plaque can narrow these arteries, decreasing blood flow to the heart. Eventually, the reduced blood flow may cause chest pain or angina, shortness of breath, or other coronary artery disease sign and symptoms. A complete blockage can cause a heart attack. Coronary artery disease often develops over decades. Hence, one might not notice a problem until one has a significant blockage or heart attack. But understand, you don't have to wait for the worst to happen. Take charge of your health now. Starting today, take steps to prevent and treat the coronary artery disease. A healthy way of living can have significant impact. Now that you know what coronary heart disease is, let's now understand what are the symptoms of this. If the coronary artery is narrow, they can't supply enough oxygen-rich blood to the heart, especially when it's beating hard, such as during exercise. At first, the decreased blood flow may not cause any symptom, but as plaque continues to build up in the coronary arteries, one may develop certain signs and symptoms such as, first one, chest pain, angina. One may feel pressure or tightness around the chest, as if someone is standing on your chest. The pain caused angina develops at the middle or the left side of the chest. Angina is generally triggered by physical or emotional stress. The pain usually goes away within a minute after stopping the stressful activities. In some people, especially in women, the pain may be brief and sharp and felt in the neck, arm, or back. Second, shortness of breath. If the heart can't pump enough blood to reach the body's need, a person may develop shortness of breath or extreme fatigue in the activities. Third, heart attack. A completely blocked coronary artery will cause heart attack. Classic sign and symptoms of heart attack includes crushing pain or pressure in chest and pain in the shoulder or arm, sometimes shortness of breath, and also sweating. Women are less likely to have neck pain and jaw pain compared to men. They may have other symptoms such as shortness of breath, fatigue, and nausea. And sometimes heart attack can occur without any sign or symptom. Now, understand how this coronary heart disease cause. Coronary artery disease is thought to begin with damage or injury to the inner layer of a coronary artery, sometimes as early as childhood. The damage can be caused by various factors that include if you are smoking a lot, or if you have a high blood pressure issue, or even high cholesterol problem. Diabetes or insulin resistance also contribute to coronary problem. And one major factor in today's time is sedentary lifestyle. When the inner wall of an artery gets damaged, fatty deposit a plaque made of cholesterol and other cellular waste products tend to collect where the injury has occurred. This process is called as atherosclerosis. If the plaque surface breaks or ruptures, the blood cells and platelets come together in order to repair the arteries. Now, when so many blood cells collect in one side, they can block the artery, leading to heart attack. Now, let's discuss risk factors. Some of the risk factors of coronary artery diseases would be age, gender. Men are generally at the risk of coronary artery disease. However, the risk of women increases after menopause. Family history, smoking, high blood pressure, high blood cholesterol level. Diabetes is associated with the increased risk of coronary artery diseases. Type 2 diabetes and coronary artery diseases has similar risk factors such as obesity and high blood pressure. Overweight and obesity are the main causes too. Excess weight can also worsen all the other risk factors. Physical inactivity, among risk factor, one very subtle risk factor is when a person catches cold and cough very often, where respiratory system is poor, oxygenation is poor, and so coronary heart diseases. High stress, unrevealed stress in life will damage arteries as well as worsen other risk factors which may cause coronary artery diseases. Unhealthy diet, eating too much food which has high amount of saturated fat, trans fat, too much salt, too much sugar can increase the risk of coronary artery diseases. Sleep apnea, this disorder can cause one to repeatedly stop and start breathing while sleeping. Sudden drop in oxygen level that occurs during sleep apnea increases blood pressure and strain to the cardiovascular system, possibly leading to coronary artery diseases. High triglyceride. This is a type of fat in your blood. High triglyceride level may raise the risk of coronary artery disease, especially in women. Preeclampsia, this condition is developed during pregnancy in some women. This condition causes high blood pressure and high amount of protein in urine. It can lead to higher risk of heart disease later in life. Alcohol use. Heavy alcohol can lead to heart muscle damage. It can also worsen the other risk of coronary artery disease. Autoimmune disease. People who have conditions such as rheumatoid arthritis, lupus, and other inflammatory conditions have an increased risk of atherosclerosis. So now, let's talk about the complications of coronary heart diseases. Coronary artery disease can lead to chest pain or angina, heart attack, heart failure. If some areas of heart are chronically deprived of oxygen and nutrients because of reduced blood flow, or if the heart has been damaged by the heart attack, the heart may become too weak to pump enough blood to meet body's needs. This condition is known as heart failure. Abnormal heart rhythm or arrhythmia, inadequate blood supply to the heart, or damage to the heart tissue can interfere with the heart's electrical impulses, causing abnormal heart rhythm. Coronary heart disease has to be managed lifelong. If one follows a healthy lifestyle, one can be comfortable to live a healthy and active life. Understand what is yogic management. Yoga emphasizes regulating four important pillars of life: They help to overcome the root cause of any disease. These pillars are ahar, food, vihar, rest, recreations, activities and sleep, achar, healthy routines, and vichar, right way of thinking. Yoga understands that generally when people suffer from cardiac disorders, they fall under the categories of type A personality. These individuals tend to be very competitive but aggressive, self critical, overreacting, impatient, striving towards goal without feeling a sense of joy in their efforts for accomplishment, have a high work involvement, have a constant sense of emergency, hurry, worry, struggling against themselves and the environment, trying to do more than one thing at a time, easily getting aroused to anger or hostility, or have explosive personality. The yogic management aims at developing a balanced and healthy lifestyle. This would help the arteries to remain clear and free from plaque. So understand food, ahar. Food we eat plays a major role in healing or harming your body. So let's understand what is the right food. Eat a healthy food, easily digestible food, fibrous food, and I often suggest that drink definitely a glass of warm water, at least a half a glass of warm water before sleeping. And this would help to prevent heart attack. High fiber, sattvic diet, rich in fruits, vegetables, and whole grain. Low salt diet. Ideally, we need half teaspoon of salt in a day, except in summer season when we sweat out too much. Have mineral salt, red salt, or black salt. Complex carbohydrate, seasonal fruits and vegetables. Healthy fat, diluted dairy products. After 30 years of age, one should drink milk but diluted 50%. Nuts, 4 to 5 almonds, at least 2 walnuts, and about 5 pistachios in a day. Definitely soak nuts overnight and include them in your morning breakfast. You can eat them later on also. Seeds, flax seeds are especially beneficial as it increases good cholesterol. Have an early dinner at least 3 to 4 hours before sleeping. Eat potassium and vitamin D3 rich diet. Along with knowing what food you should have, you should also be aware of what food you should avoid. Tamasic food, that is stale food, highly refined products, highly deep frozen products should be avoided. High salty foods like papads and pickles, snacks like chips, salted nuts, processed and packaged foods. They are high in sodium. That's why they want extra water in body and body stores extra water. And naturally this will increase blood pressure. High fat food, saturated and hydrogenated food like butter, vanaspati, cheese and trans fat. Look out for partially hydrogenated or fractionated in the ingredients section. Heavy protein, especially at night, like meat, kidney beans, chickpeas and soya. Gassy and acidic foods like potatoes, cabbage and polished rice, etc. Smoking and drinking. Next is vihara, or rest, recreation, sleep, etc., which is another important factor to achieve good health. As these patients are workaholics, it is very, very important for them to take out time for recreation. It could be through a hobby such as gardening, walking, spending time with family, etc. Nature walk in calm surrounding. Walk daily. Begin with 10 to 15 minutes of slow-paced walk. Gradually build up to half an hour of brisk walk, followed by 15 minutes of shavasana if tired. Rest for a few minutes in between the walk. In the institute, we have seen many people suffer from hypertension benefiting from these simple activities. 8 hours of sleep is essential. Swimming is also a good exercise for cardiac patients. Relaxation is at the root of yoga therapy. For cardiac patients, to develop calm and relaxed attitude towards life. All relaxation techniques can be practiced. Choose any one relaxation technique to practice thrice a day for 20 minutes at a time. The third most important pillar is achar or routines. Our routine always plays a very crucial role in our day to day life. Follow doctor's advice and have a regular checkup. Maintain a checklist and keep an important and emergency information handle. Maintaining healthy weight helps in reversing or managing the heart problem. Have timely meal, eat on time and rest well. If you are on the move, traveling, then carry some cardiac healthy meals. Have sun on your back, have sunbathing and keep your feet always warm. If possible, if you are in the house, use a hot water bag after meals on your abdomen. Being active is fine, but overexertion should be avoided, especially after eating food. Be aware of the signals of your body while being active and stop when you are feeling stressed. Be aware of one's own body to catch the initial sign of change in blood pressure and some symptoms like heaviness of head or dizziness. When comfortable with walking, one can gradually add few simple asanas like lying down, yastikasana, matsyasana, sitting, parvatasana, and meditative posture. Start the asanas of sitting and lying down position. Avoid back bending and forward bending to begin with. Later, variations of Viparit Karni should be practiced, and this variation could be try and put your leg against the wall. It is a restorative pose. In addition, gravity helps circulation by facilitating the return of venous blood and lymphatic fluids back to the heart. This is then oxygenated and circulated back in the body. No holding and suspensions in asana and pranayama. Practice Rechak and Yogendra Pranayam 4. Also, practice Anulom Vilom without holding. Kriyas such as Kapal Randra Dhotis, Karna Randra Dhotis should be done. Practice Yoni Mudra for 1 minute every day. Now, we come to the last pillar, and that is Vichar. Emotional factors play a major role in our health, and hence the emotional management becomes very crucial thing for recovery. Be aware of your thoughts. Maintain awareness and cheerfulness during work, and do it with dedication and joy in a relaxed way. Write 10 positive points every day. This would take your mind away from negative to positive. Develop faith in self and higher reality. It is important to understand that we are that little small part in the functioning of the universe. So, what we can do? We have to do our duty and surrender to God its results. Manage stressful situations, manage stressful conditions, manage all the triggers of your life. Practice Vairagya Bhav, little objectivity, little detachment to develop a relaxed attitude towards life. This can be achieved by practicing relaxation asanas too. You are lying down in Shavasana, let go your body weight. Learn to let go, chodo, relax. That would really help. Practice bhavanas like Sakshi Bhavana, Anitya Bhavana, and Pratipaksha Bhavana. Practice of parikarmas, that is Maitri, Karuna, Mudita, really helps to manage with people, and it helps to manage our own emotions. Working on these 4 pillars would result in a holistic approach in achieving an optimal health. Ensure that in day-to-day life we focus on these 4 pillars: Ahar, Vihar, Achar and Vichar. So now you know everything about coronary heart diseases. What is it? What are the causes? What are the symptoms and how to manage it? Most importantly, you are aware about the yogic management technique that would help you to deal with this condition and let you live a happy life without allowing any conditions to control your thoughts. So, follow these beneficial techniques and bring the change in your mindset, improve your general health, improve the health of your mind, and have a very healthy and happy life. Namaskar.